If you or someone you know has ever been worried about their sleep, whether it's snoring or sleep apnea, you may want to listen closely to our next guest. Gilad Glick is the CEO of Itamar Medical, and he joins us here today to talk about an incredible new home diagnostic device. Gilad, thank you so much for coming.
Thanks for having me.
All right. So first of all, what is this device? It is the WatchPad.
Yeah, WatchPad is the world's, I would say, simplest sleep apnea diagnostic device that is medical grade and recognized by the American Association of Sleep Medicine for being accurate and professional diagnostic tool.
So, okay, now how exactly does it work then? You know, what's different about it?
Well, it's brilliant, and I'm biased, of course, but you know, most sleep apnea diagnosis is based on airflow measurement. It's looking at the flow of air coming out of your lungs through the nose out and counting the amount of time there is a stop in breathing during the night. Of course, it's very cumbersome. You need facial interfaces, you need all kinds of probes. The big innovation of WatchPad that it does everything from a single finger, yet it's as accurate as a full sleep diagnostic lab, as if you went to the hospital for a polysomnography.
So, and you know, this has been under construction for like 20 years, I understand, or under development rather.
The invention was almost 20 years ago, yeah. It's done, actually, one of the inventor is Professor Peretz Lavi, which is the head of the Technion, Israeli Technion today.
Okay.
And yeah, since then we've been in clinical studies and regulatory submission and marketing the product around the world.
That's amazing. What inspired this innovation? You know, why the sleep apnea?
Right. So the sleep apnea is a big disease. It's impacting roughly 25% of the adult population in the Western countries. And the means of diagnosing it so far has been complicated. You had to go to a hospital, be admitted, you know, wear your pajamas, go to the sleep lab. It's cumbersome. So the diagnosis rate was very low. Just few percentage of the general population that is sick actually been diagnosed. That device does it at home. You take it, and it's just a watch and a probe, and the next morning you're formally diagnosed, or not, depending on your disease, for your sleep apnea.
So, all right, so let me hear a few more numbers. You know, what are some of the results that you've already gotten back from this device? You know, what are early numbers and statistics?
Right, so we're present around the world. We know that sleep apnea is an epidemic proportion disease. As I said, 25% of the adult population, it's enormous. 80% of them are undiagnosed. Those are formal numbers out of the various associations. The reason is that it's difficult to diagnose it. Our mission is to get all those people diagnosed as needed.
So then, okay, so what was the alternative? You said you have to physically go to the hospital under a normal diagnosis.
Right, the gold standard is go to the hospital, admit yourself for overnight sleep test. It's called polysomnography. Get hooked up to many complex devices, and the next morning get your diagnosis. That's the gold standard. We're replacing it with a home-based device that is as simple as a watch. But it's still medical grade. It's not one of those gadgets that you buy over the internet. It's recognized, it's reimbursed, and it's, you know, you can get a prescription for your therapy based on the diagnostic of this device.
Okay, and this is like covered by most medical insurance plans and things like this. Is just a normal diagnostic tool that you go into the hospital and you can ask for.
Right, it's a prescription device. You need a doctor to prescribe it, and then it's fully covered by Medicare, and I would say most commercial carriers in the US and around the world.
All right, so what does it cost? I suppose I should ask.
It costs you as much as asking your doctor.
As your insurance. So they will cover it. It should be covered under any major insurance policy.
Right.
All right, and you can only you can't just order it at home.
No,
I can't.
It's a prescription device. Yeah, it's a medical grade prescription device. It's very accurate. It's not dangerous. It's not invasive. You just wear it, but it's very accurate. And the insurance company want to make sure expensive tests, it is expensive for them, not for the patient, are prescribed by physicians.
Very interesting. All right. What else is kind of coming out in the market right now? You got any new products that we should know about as well?
Right. I would say more focused. Device is very good. It's really approved and cleared and tested and validated. What we are focusing on is the cardiology market. So I told you, quarter of the adult population suffer from sleep apnea. Well, 2/3 of cardiac patients suffer from sleep apnea. Most of them are undiagnosed. Not only that, it was proven that sleep apnea deteriorates your cardiac disease. So big mission of ours now is to address that market. If you're a cardiology patient, you want to be tested for sleep apnea and get your therapy, which is a CPAP usually. That will improve dramatically your cardiac care.
Oh, wow. And then Well, that's incredible. Well, thank you so much
Yes.
for coming in, and I hope everybody gets the word out on this. I mean, it sounds like a very important device.
Right. Ask your doctors
Ask
for
your
sleep
doctors.
apnea and ask for WatchBut.
All right. Well, thank you so much for coming in.
Thank you very much. Take care.
Excellent.